How to treat acne in 5 min, overnight or holistically for life. When acne decides to hold a pop-up on your face, breathe. There are few things as unwelcome as the arrival of a blemish to be. We've all experienced acne more than once, yet that doesn't mean we're ever less surprised when a zit decides to take up residence again. Breathe, it's okay. As the most common skin condition in the United States, you and everyone you know has likely all dealt with a zit, or 20, before. This stat doesn't mean love your acne. It's more of a reminder that anyone who makes you feel bad about having it is wrong. Your pimples don't have personality, you do, and your personality is what makes your face lovely to look at. Still, we get it, you're going to want to pop. So before you do so, read our roundup of the cleanest, in order of the quickest, ways you can treat blackheads, whiteheads, and cysts. And whatever method you end up trying, remember that these fixes aren't meant to be treating your whole face, but for the 1 to 2 surprise pimples. For chronic acne, jump to learning about long-term strategies so you can minimize the blemishes after they've cleared up. Treatments that work in 30 minutes or less. 1. Pimple cover-up. Under 1 minute there's no blemish that a dab of cover-up can't hide. Use green concealer to hide any potential redness, or salmon, orange concealer to counteract the blues hues on darker skin. For lighter or smaller acne, just skin-colored concealer might do for a smooth cover-up. When applying, remember this. Use proper lighting, make sure you have a small brush for tiny cover-ups, and keep a blending sponge for a completely silky finish. Skin tip. In order to find your perfect makeup match, and to protect against possible skin allergies, always test out the product on your skin before use. If you don't wear makeup enough to justify a pot, consider looking for sample packs or braving a day without cover-up. You might realize how little other people notice. 2. Ice on pimple. 1 minute or more the use of ice can go a long way. This cooling method works best for inflammatory acne that flares under the skin, including cysts, nodules, pustules, and papules. Directions. 1. Begin by cleansing your skin. 2. Then, wrap the ice cube in a thick towel, cloth, or use a cold compress. 3. Apply the ice for 1 minute and then remove. If your pimple is particularly inflamed, you can follow it up with repeat sessions, but wait 5 minutes in between each application. Continue to ice your pimple until it's gone down enough to cover up. Do this daily if the pimple persists. 3. Acne patches. 20 minutes minimum. Can small adhesive dots really suck the life out of your pimple? Yes, although how long it takes depends on the type of acne, as well as if it has a head, or has an opening to release sebum. From spots that reduce pimple size in just 6 hours to waterproof patches that will act on blemishes overnight, you're sure to find a patch to suit your skincare needs. Directions. 1. Clean the area around the pimple. 2. If needed, lance the pimple, only if it has a head, with a sterilized tool. 3. Apply sticker directly to your pimple and wait. It's important to note that just like any acne treatment, patches may not provide the same results for everyone. Dermatologist Susan Obagi, doctor and director of the UPMC Cosmetic Surgery and Skin Health Center, notes that finding your perfect acne-fighting regimen often requires trial and error with products. 4. Draining a pimple. 5-15 minutes. Derms and estheticians like Dr. Obagi warn that serious complications can arise during at-home experimentation of lancing or popping a pimple. In the case of particularly large or painful cysts, she recommends seeing a doctor, noting that the use of unsterile instruments can be a setup for disaster. However, we know that even one pimple can wreak havoc on our esteem, so if you don't mind, or prefer, potential scarring, follow these instructions carefully. Directions. 1. Begin by following your usual facial cleansing routine. 1. Don't overwash or irritate the area, but ensure that your face is clean. 2. After cleansing, you should cover the area with a warm compress. 2. You'll continue to cover the blemish with a warm compress until it drains. 3. In the case of an inflamed cyst, you can use ice in between warm compress treatments to reduce swelling. This method will allow for any acne substance lingering in your pores to come out, which will prevent you from using your fingers or an unsterile instrument for popping. 5. Mask treatment. 15-20 minutes. Give your pimple a little TLC with an easy-to-follow mask treatment. Before you layer on the mask, clean your skin, exfoliate, and then add the mask. For a mask treatment, you want to pick a product that has ingredients like charcoal, Aztec clay, and sulfur clay, known for clearing up acne. 6. Cortisone shots. 4 to 8 hours. In the case of severe and painful acne, you may want to schedule a visit with your doctor for a cortisone shot. The $25 plus shot, depending on your insurance, is injected directly into the skin and helps to quickly fight redness and speed up the healing process. 7. Spot treatment. Overnight, at least spot treatment is a targeted method that can take a little time and is best followed up with an acne patch. You may want to ice the pimple before spot treating, especially for bigger zits. After washing your face, ice the pimple for less than 5 minutes. Follow that up with the application of an over-the-counter pimple product of your choice. Be sure to apply a spot treatment that contains ingredients noted for their acne-fighting abilities, including essential oils, like tea tree or witch hazel, sulfur cream, benzoyl peroxide, aloe vera, salicylic acid, cortisone cream, a drying lotion. Once applied, you want to keep your fingers away and wait for the pimple to